Welcome to HIMSS TV Insider. Chris, thank you very much for joining me today. My first question for you is, what is the top concern of your customers as it relates to cybersecurity?
Well, let me start by saying thanks for having me. It's always a pleasure to come and speak with people and get that message out so that people understand what's really percolating out there in the market. You know, it's interesting. We speak to a lot of customers across the entire healthcare ecosystem, from healthcare providers, academic medicine, all the way to the vendor ecosystem. And what's really top of mind is the increasing reach of breaches these days. And I think that's becoming a really big concern because if you look statistically, most of the breaches that we're seeing are coming from the ecosystem, from those business associates, right? So healthcare organizations are really struggling to understand their environment and who's helping support them deliver that mission of patient care, right, and patient safety. And it's a number of reasons why I think that's a concern with them. First and foremost, the demand is outstripping the supply, right? So there's a gross shortage of qualified practitioners in the field, and they're being asked to do more with less. If most security teams that I talk to and the CISOs that I talk to, they're fighting for budget with innovation projects that are happening in their organization. They're just not getting the resources that they need. And then if you think about the other side of the coin, innovation that's striking the enterprise, if we'll just use a buzzword, AI, ML, right? We hear that constantly in the space. What's the real impact when you have a third party come into your organization that has that type of technology or solution? Security teams aren't equipped to deal with that today. Maybe they just don't understand it. Maybe they just haven't found out that that vendor lives in their environment at this point in time, right? And then the other side of the last piece of the puzzle for those folks is that how do you monitor this in real time? I mean, they're using antiquated tool sets today to really think about, how do I know what my vendor landscape is? What's the impact of how this is integrated with other health systems? How is it reaching the patient now that the patient may not be even in the hospital? They may be in their home. So that reach and that impact with that lack of understanding and visibility is really starting to create a tipping point for these health systems that we speak with today. And the concern around their third and fourth party vendors and cause for breach, it's significant.
And given that context, in an ideal world, regardless of budget and everything else, and the size of the organization, what do you feel is your top recommendation for securing the environment?
So there's a couple of things there, but I'll start with make it an enterprise priority, right? It doesn't cost anything to make cybersecurity an enterprise priority. Don't just live in the silo where you may be buried in an IT organization, or maybe you have the luxury to be in compliance and audit. Get the entire enterprise involved, right? Business owners who are bringing forth cutting edge solutions to solve for patient care problems have to be involved in the decision-making when it comes to risk. One thing that I would recommend to any organization is that you're never going to eliminate all risk. You have to find the right appetite for your organization and what risk they're willing to accept. That's not a decision made by the CISO. That is a decision made by the entire organization. So really looking at it from the lens of, I don't have to spend money on this. I just have to get awareness out there. I have to build a campaign so that people understand what their role and their responsibility is, understanding the risk within the organization. That's going to create a better cybersecurity program. Once everybody has a little bit of ownership in it and they see what the value is and what the downfall could be to patient care, they start caring about it, because nobody wants to see patients get injured from cyber issues. Everybody wants to see a positive outcome and how we better and further patient care, right? And better quality care. That all has cyber tied into it with so much how we've digitized today.
And what do you feel is unique about your company's solutions?
Well, it's interesting because we've really built a digital risk exchange for healthcare organizations to really understand what that cyber posture is with their vendor landscape, right? So it's really about visibility at that point, ensuring that they're not only looking at their most high-risk vendors and itemizing or listing those high-risk vendors by control sets, but all the way down to those low-risk vendors, full portfolio management at the end of the day. And it's not just on the healthcare provider side. We've also opened that platform to be, quite honestly, data sharing through the vendors as well. So they can manage, they can store, they can put evidence and show the control sets that they have in place so that there's an ease and comfort with the assessing organization and the vendor to build a relationship. I think that's the biggest takeaway. That network effect that we've created is allowing organizations not just to build relationships, but also work closely with those vendors to say, hey, listen, we have requirements for very specific remediations or corrective actions. Let me manage those in one place. Let me validate that you fixed it. And when your posture changes, we're doing it in real time, near real time, and you're seeing those changes take place. So you're actively managing that risk management program and hoping removing risk in a near real-time fashion.
Finally, in terms of a message to attendees at the HIMSS Healthcare Cybersecurity Forum, what would you like to convey to them?
So I think this is an interesting time that we live in. If you think about the nature of breaches and how far it extends beyond the walls of the hospital, it's not an isolated incident or an isolated event anymore. If you look at the 7 largest breaches in the last year, just the past 7-8 months, it has had a regional impact, right? So again, the key takeaway for me is that cyber is not an isolated event that takes place just within the 4 walls of your hospital or your health system. It can have a long-lasting effect and an impact on patient care across your entire region, even across the United States or potentially globally, because there's so much interconnectivity that's taking place. So thinking of it from that lens and that mindset, we got to get better at talking to one another. We got to get back to the basics and really start to understand, how does my organization impact the organization down the street if we were to have a ransomware attack? You're going to flood that other organization with patients. Can they handle it? So it's really about communication and resiliency, knowing that cyber incidents are regional now. It's not just isolated to one practice or one hospital.
Absolutely. Well, thank you, Chris, very much for your thoughts and expertise.
Absolutely. It's been a pleasure. Thank you for having me.